how hard you try to, like no matter how hard you try to not get emotionally attached. So in those cases, like how do you cut yourself off from that
No,
situation?
and it's really hard, as you know, right? It's there was a time where I worked for this organization, Weave, and I was the managing attorney there. And about 4 years into it, I realized that my behavior started changing at home. That I started not wanting to go out. I was always angry at the kids. I was always like not cooperative with my husband, and picking fights for the smallest reason, or for no reason, right? And then at one point he said, I think your cases are affecting you. And I was like, what rubbish. How can you say something like that, right?
Yeah.
Immediately said no. But then I started thinking about it, and he was right. My cases were affecting me.
Okay.
In this line of work, when you talk to any caregiver, not just me, but if you talk to someone that works in ER, you talk to someone that's a physician, you talk to someone that does volunteer work with homeless. When you have a job that requires giving, right, or listening, have you heard of vicarious trauma?
No.
So vicarious trauma is trauma that you get as a result of listening or participating in somebody else's trauma.
Oh, wow.
And so in terms of diagnosis and recognizing, someone can have a PTSD diagnosis through vicarious trauma.
Oh, really?
Yeah.
Wow. Okay, even though you're not
directly involved in the trauma because of the work that you do.
Okay.
So
I'm getting goosebumps.
No, but it's true, right? Because
yeah.
it impacts you. So I think it's something that I have to regulate almost on a daily or hourly basis. Sometimes when I get upset or angry, I really have to think about what is causing this. Is it what I heard? Is it what somebody did? And how is it affecting me? Then you realize, oh, it is affecting me. Then you have to step back and say, okay, you've got to let it go. So you've got to find a way to let things go. And nobody's perfect. So I'm going to admit that it doesn't happen easily, right? But you have to also recognize that if it's then interfering with your life or causing harm or stress, or you really need to kind of take a step back and get some tools in place.
Oh, okay. On this note, I would like to know how a lot of people hesitate to go to see a therapist or a psychologist. What would you advise to people who identify? Most times they don't identify it. It's the immediate family who gets affected.
Right.
So attempting, at least go checking out a therapist, what would you suggest to those folks?
So I would say absolutely. I highly recommend it. And in fact, I've been to therapy in the past. It's not easy. It's difficult, it's uncomfortable, you sit back and you're like, wait, what just happened here? But I feel that there's value in allowing a professional, because at the end of the day, all of these people are trained people. Okay, there's value in allowing a professional to help you.
Okay.
And if you honestly believe that, if you're so against it that it's not going to help you, then don't do it, but find another way. Is that going to be going to the gym? Is that going to be doing yoga? Is that going to be taking a walk or running for 30 minutes? I don't know. But if therapy is not going to work for you, then find another way, because I will not accept non-action or inaction as an answer, because nothing's going to change.
Sure, and it's going to get worse.
Oh, absolutely.
And then most immigrants might have this question with the confidentiality and all that when you see a therapist. So what do you think about that?
So that is absolutely a condition. There's also what is known as a therapist-patient privilege. That's a legal term, okay? Both your medical records are confidential, right? And your therapy sessions are also going to be confidential. It takes a lot for somebody to be able to get your therapist to court to testify.
Okay.
And so I would say that do not worry about the impact of that.
Okay.
It's not going to reflect on your any immigration status or anything or
Okay.
paperwork. It's not going to reflect, your criminal record or anything like that. Therapy. And there are laws in place that protect what you say to the therapist. I mean, obviously there are other things that fall outside of it. So for instance, there's, if you disclose to your therapist or psychiatrist or a doctor that you want to harm somebody and that you have a plan in mind or whatever,
Okay.
that stuff can be disclosed.
Yeah.
And that stuff can be reported because obviously nobody wants you to go out and hurt or kill somebody.
Yeah.
But for most of us that don't have these immediate desires to hurt or kill somebody, right? I think therapy is really needed and a good thing.
Okay. Thank you very much. I